Hello, this is Donna Deal with the Division of Developmental Disabilities. I will be focusing on Chapter 2 of the ICAP training. This chapter covers sections A, B, and C. These sections can also be found in the ICAP guidelines on pages 4 through 9. The first section is A, Descriptive Information. The items in this section are fairly self-explanatory. Here you will be marking the sex of the person, their height and weight, and we recommend that this is information taken right off the physical, so you get the most current height and weight. And then looking down on question number 7, primary means of expression. Here we would like you to mark one answer for the main way that the person communicates, whether it's through verbalizing words or through gestures. Maybe they use a communication device, maybe they use sign language, and some folks might even have something like an eye gaze that they use, or they may point. We would really like to see something marked here rather than none, because each one of us has a way of communicating through actions, sometimes even behaviors can be considered a way of communicating. So we would like to see something marked rather than none. Number 9, legal status. Here you will mark whether the person is their own guardian or has an appointed guardian. If you score numbers 2, 3, or 4, we would like to just let you know that that should be backed up with a court order, so you have that documentation available if it ever needs to be verified. The next section, B, is the diagnostic status. Here you will see 2 columns. The first column is primary diagnosis, and then the second column is any additional diagnosed conditions that the person has. So first, let's talk about the first column, primary diagnosis. There are only certain diagnoses that we would accept on the ICAP as a primary diagnosis, and those would be number 2, autism, number 4, brain or neurological damage that occurred prior to the age of 22, number 5, cerebral palsy, number 8, epilepsy or seizures, number 9, intellectual disability, and number 13, other, if borderline intellectual functioning is documented. The other categories that I did not name would never be considered a primary diagnosis. So those would be blindness, and when we're talking about blindness, we're talking in both eyes. Chemical dependency, number 6, deafness, number 7, 10, physical health problems, 11, mental illness, and 12, situational mental health problem. These can only be considered additional diagnosed conditions. So going back to the primary diagnosis, for those ones that I named, we would also want to make sure that there is assessments available to document and validate those diagnoses. So we'd want to, you'd want to make sure that you have access to things like autism evaluations, if that's how you're going to score the person. Brain or neurological damage, we'd want to make sure that you have neurological evaluations. Cerebral palsy doesn't necessarily have an evaluation per se, but if it's something that's been documented in records from birth and then carried on throughout the person's physical history, then that would suffice. For the intellectual disability, we'd want to see the psychological evaluation that would identify the person's full-scale IQ scores. And then for number 13, other, there are only 2 times when other would be marked. And the first time would be, the first time would be if a person has a full-scale IQ of 71 to 84, and they're actually diagnosed with the borderline intellectual functioning. And then you'd want to score other as primary, and then write in borderline intellectual functioning in the little blank there by other, or down below in the comment section. Borderline intellectual functioning is allowed as a primary diagnosis only if the person does not have another primary diagnosis, such as autism, brain or neurological conditions, cerebral palsy, seizure disorder. The other time when 13 other can be marked is when the person has a high level of required care by a nurse or physician, so monthly or more, and then the person does not have a physical problem or seizures. The ICAP CompuScore program only allows documentation of required care to be monthly or more when the primary and additional diagnoses reflect a physical health problem, seizures, or 13 other. So mental health problems requiring care by a psychiatrist may increase a person's medical needs. We recognize this and allow 13 other to be marked with a written explanation in the comments section of psychiatric care. This then opens the CompuScore program required care in section C of the ICAP and allows accurate documentation when a person's mental health needs exceed monthly or more required care. So in summary, for the primary diagnosis, you would only mark 1 in that category or that column. And then in the second column, you could mark as many additional diagnosed conditions that apply to the person. And if you want to do further explaining or list those, you could do that in the comment bubble there at the bottom of that page. Just a few more things to note on the diagnosis. Once again, when we're speaking of blindness, we're talking about both eyes. When we're speaking of deafness, we're talking about deafness in both ears. When we're talking about physical health problems, number 10, those are chronic conditions that typically a person is being treated for on an ongoing basis or is taking medication for. Mental illness, this needs to be an actual formal diagnosis and is also requiring that ongoing treatment by a psychiatrist. And typically those individuals are also using medication. Situational mental health problem is more of a time-limited occurrence. An example of that would be someone loses a family member, and so the person is suffering from depression and maybe not getting around and going about their day-to-day activities due to the grief that they're enduring. But knowing that as time goes on, the grief will continue to lessen and acceptance occurs, and so the person is able to kind of move on and get back to day-to-day life. So it's time limited. That would be an example of what a situational mental health problem looks like. Next, we will talk about Section C, which is functional limitations and needed assistance. Here, the first question is level of intellectual disability. Here you will mark, based upon the psychological evaluation, what the person's IQ score is. And we ask that you look at the most current psychological evaluation when you are scoring this particular question. Vision, here you would mark the person's ability to see. Once again, we're talking about both eyes, and if they wear glasses, you would score them with the use of their glasses. And hearing is number 3. Here you would mark the person's ability to hear, once again, taking into consideration both ears. If the person wears hearing aids, you would score them with the use of those hearing aids. Number 4 is frequency of seizures. If the person has no seizures, you would obviously mark none, number 1. But if they do have seizures that occur, then we'd want to consider the frequency. First, you would want to look back over the period of the last 3 months from the date that you are completing this ICAP, and take a look at how many seizures that person had in the last 3 months for an average. If they haven't had a seizure in the last 3 months, then you'd want to go back for a year and take a look at how many seizures have occurred. And that will help you to determine if they're having less than monthly, or weekly, or more often seizures. The next question, number 5, is health. And when scoring this one, once again, we are talking about chronic problems, chronic health problems that typically involve body organs. So let's think of, heart problems, diabetes, things that, need treatment and oftentimes medication. And it has to really affect the person's daily activities to be scored here. So if it restricts their ability to complete their independent living skills, you'd want to take that into consideration. If it impacts their ability maybe for recreation, not so much. This is more just about their day-to-day independent living skills, if it impacts them and keeps them from doing more for themselves. The next question, number 6, is required care by nurse or physician. This was the question I referred to a few minutes ago when we were talking about marking it when it involves someone that has a lot of psychiatric care that also impacts their physical health. But this question is getting at how much medical care is required by the person, and getting that care from a licensed nurse or physician, physician's assistant, or certified nurse practitioner. Things that wouldn't be considered here would be routine things that we all do. So we're not talking about an annual physical or dental cleanings. We're not talking about flu shots or taking your blood pressure. We're talking about things that are administered in a more specialized capacity. So for instance, people that see specialists, cardiologists, neurologists, pulmonologists. So those types of appointments, it can be psychiatrist appointments, blood work would be considered in this category, nurses taking orders for medication changes or prescription changes over the phone by the doctor. Those can all be considered because those are things that a licensed nurse or physician has to do. And so what you'd want to do here is also take a look back over the last 3 months from the date you're completing the ICAP and start counting up how many of these required care appointments or activities have occurred for the person to help determine that frequency. And then also from that point, taking a look back at an entire year, because sometimes a person might not see a specialist except for once a year or twice a year. So it's important to look back over that whole past year and count the frequency in order to get an accurate picture of how much required care by a nurse or physician is required of this person, and then mark that accordingly. Number 7 is current medications. And here you're going to mark the categories, and it can be more than one. Mark all the categories that apply to the types of medications that the person is taking. So obviously, if they're not taking anything, you'd mark none. Otherwise, if they're taking medications to treat a health problem, you would mark number 2. And it's good here to cross-reference, maybe going back to those diagnoses in section B. If you've marked physical health problems, and as I said earlier, many people are taking medications to treat some of those chronic health problems. So you'd also want to score number 2, health problems, under medications for anything that they are taking to treat those conditions. Here's also where you would mark or capture birth control. We would like to see that reflected under number 2. And then number 3, for mood, anxiety, sleep, or behavior, those would be any psychotropic medications that the person is taking. Number 4 is medication that a person is taking for epilepsy or seizures. You would mark that. And then other, that category is typically where we see it marked for folks that are taking over-the-counter medications. Also, if meds are given prior to a doctor or dentist appointment, we would typically see those listed here under the category of other. And then also at the bottom of that page, you will see a comment bubble. It's sometimes helpful to go ahead and write the names of those medications in. You certainly don't have to, but it's sometimes great to have that list of medications that you were using at the time of the completion of this ICAP to select your categories, so that when looking back at it, people can also take a look at that list and the scoring that you did. Number 8, arm hand. This question is all about the person's abilities and then how much assistance or support is needed. So how much assistance and support is provided by staff or family members to assist the person. Here you will see there's 3 options. No limitation in daily activities, so that means a person can do everything on their own as far as using their arm or hand. 2, some daily activities limited. This means a person has some physical limitations and would require assistance from another person for certain things. And then number 3, most daily activities limited. Here we're talking about maybe a person who has contractures or maybe an arm that is paralyzed and they have little to no functional use of either arm and always requires assistance from someone else. Then that you would mark number 3, most daily activities limited. Number 9 is mobility. Here you would mark 1 answer. Either the person walks or they do not walk. So a person using a wheelchair full-time, you would mark does not walk. Number 3, limited to bed most of the day. Or number 4, confined to bed for the entire day. We don't see much of number 3 or 4, especially number 4. Most people, don't require to be in bed for the majority of their day that receive supports within our population. And then 10 goes along with that, takes that mobility a little bit further. Now we're talking about the mobility assistance needed. And here we're asking you to mark all that apply, so it can be more than one answer. Once again, if they don't require any assistance, you would mark none. If they use a device like a cane, a walker, a wheelchair, anything like that, you would mark number 2. And then number 3, you would mark this if the person occasionally needs help of another person. And when we're talking about needs help and assistance, we're talking about getting from point A to point B. So maybe getting from the bed to a chair, or from their wheelchair to the toilet, or from their bed to the recliner. If the person only needs occasional help to get around, maybe they just need someone to steady them a little bit while they're walking on uneven surfaces, and it's not something they require all the time, it's just occasional in certain situations, you would want to mark occasionally. If a person always needs help, they're always needing help with transfers, they always need someone with them, maybe they always need someone to push their wheelchair, then you would want to mark always needs help of another person. So just in summary, when considering sections A, B, and C on the ICAP, you'll start to see that the ICAP is kind of like putting together pieces of a puzzle. There's many times to cross-reference back and forth. Some of those I've pointed out. If you have marked a diagnosis of seizures, then we would want to take a look at number 4, frequency of seizures, and you'd want to make sure that those scores correspond and correlate. If a person has a diagnosis of physical health problems, maybe they have high blood pressure, then you'd want to take a look at that medication section in section C, number 7, to see if they're taking any medication to help with that problem. If the person has deafness marked, we'd want to take a look at number 3, hearing, to see how that is scored and make sure, once again, that those coincide. So there's many ways to cross-reference, and it starts to form a picture in your mind of the person as far as what kind of assistance and supports that they're going to need on a day-to-day basis. This concludes the training for Chapter 2. Please continue to view the additional chapters in this ICAP training series. And always remember to refer to the ICAP guidelines and other resource tools available to you. If you need further assistance, please contact your assigned program specialist at the Division of Developmental Disabilities. Thank you.